Taglia, extension 198.
As an employee for a medical facility, you could face exposure risks while carrying out your routine duties. You face the risk of coming into contact with bloodborne pathogens. Bloodborne pathogens are the infectious materials in blood that can cause diseases in humans. Bloodborne pathogens include the hepatitis B virus, HBV, hepatitis C virus, HCV, and human immunodeficiency virus, HIV. Workers exposed to those pathogens face the possibility of serious illness or even death. This program will teach you how to protect yourself from these and the many other bloodborne pathogens found in the healthcare setting. Bloodborne pathogen infections are transmitted in the general population through sexual contact, IV drug use, and direct exposure to blood and other potentially infectious body fluids. The most common way a worker in a medical facility can become infected with bloodborne pathogens is through contact with infected blood by way of a needle stick, a cut with a sharp object, or through breaks in the skin, and through a mucous membrane, such as the eyes or the nose. In order for infection transmission to occur, 4 conditions must exist simultaneously. First, there must be a sufficient amount or dose of infectious material present. Health authorities have defined a single drop of blood or infectious material as enough to constitute a sufficient hazard. Second, a sufficient virulence or deadly nature of the disease must exist. Third, there must be an available portal of entry, such as the eyes or nasal passage, a needle puncture, or an open wound. And fourth, there must be a lowered resistance level of the worker. In other words, if you are tired or have the flu, you become more susceptible to infection. Most exposures do not result in infection. Following an exposure, the risk of infection may vary with factors such as the pathogen involved, the type of exposure, and the amount of blood or body fluid involved in the exposure. Hepatitis B is a disease that attacks the liver. HBV can result in a lifelong infection, causing cirrhosis of the liver, liver cancer, liver failure, and death. Hepatitis B is especially dangerous because it can survive in dried blood at room temperature on environmental surfaces for at least a week. Anyone with occupational exposure to blood is at risk of contracting the infection. That's why all employees exposed to blood or other potentially infectious materials as part of their job duties must be offered the 3-injection hepatitis B vaccination series. Hepatitis C is a liver disease caused by the hepatitis C virus, which is transmitted through contact with the blood of an infected person. There is no vaccine against hepatitis C, and there is no treatment after an exposure that will prevent infection. Human immune deficiency virus, HIV, is the deadly virus that causes AIDS, acquired immune deficiency syndrome. HIV is transmitted through exposure to the blood of someone infected. There is no vaccine or cure for HIV or AIDS. Employees whose job duties place them at risk of exposure to bloodborne pathogens must receive bloodborne pathogen training, the hepatitis B vaccination, and appropriate personal protective equipment. The exposure control plan is used to determine which employees are at risk of bloodborne pathogen exposure and how to eliminate or minimize employee exposure. An effective approach to preventing occupational exposure to HBV, HCV, HIV, and other bloodborne pathogens is to practice universal precautions. This means that workers should assume that the blood and other body fluids from all patients are potentially infectious. The following body fluids are not considered potentially infectious unless they contain blood: feces, nasal secretions, saliva, sputum, sweat, tears, urine, and vomitus. An engineering control isolates and removes hazards from the workplace. They include sharps disposal containers, self-sheathing needles, and safer medical devices such as sharps with engineered sharps injury protection and needleless systems. Engineering controls must be examined and maintained regularly to ensure their effectiveness. Employers must involve employees in selecting effective engineering controls to improve employee acceptance of the new devices and to improve the quality of the selection process. Work practice controls reduce the likelihood of exposure by changing the way a task is performed. They include appropriate procedures for hand washing, sharps disposing, lab specimen packaging, laundry handling, and contaminated material cleaning. Examples of work practice controls are no hands procedures in handling contaminated sharps and eliminating hand-to-hand instrument passing in the operating room. By using engineering and work practice controls, employers can protect workers whose jobs put them at a reasonable risk of coming into contact with blood and other potentially infectious materials. Hand washing is an integral part of infection control. Hand washing with soap and running water must be performed as soon as possible after contamination of the hands to remove material from the skin, especially when the hands have been grossly contaminated. Hand washing with antibacterial or antimicrobial soaps removes and kills microorganisms. Healthcare workers must wash their hands at the beginning of their shift and at the end of their shift if contact with blood or other potentially infectious material has occurred or if gloves have been removed. Healthcare workers must wash their hands between patients. Hands must also be washed before and after touching wounds, before performing invasive procedures, when taking care of susceptible patients, such as the immunocompromised, or when handling infants, before handling medications, before and after eating or smoking, after using the restroom, and when hands are soiled or they touch a potentially contaminated surface. Hands must be washed before putting on gloves and after gloves have been removed. When hands are not visibly contaminated, an alcohol gel product may be the fastest and easiest way to remove germs. When alcohol gel products or antiseptic towelettes are used, employees must wash their hands with soap and running water as soon as possible thereafter. Employers are required by OSHA to provide appropriate personal protective equipment and clothing free of charge to employees. Wearing gloves, gowns, masks, and eye protection significantly reduces the health risk for workers exposed to blood and other potentially infectious materials. The type of protective equipment used depends upon the expected exposure. For example, gloves and a lab coat may be suitable for a lab technician who is drawing blood. Gloves may be suitable for housekeeping staff, while a laundry worker handling blood-soaked laundry would need gloves and considerably more protective clothing. Personal protective equipment may include gloves, gowns, lab coats, face shields or masks, eye protection, pocket masks, and other protective gear. Personal protective equipment should be provided in appropriate sizes and be readily accessible to employees. Gloves must be used when there is reasonable anticipation of employee hand contact with blood or other potentially infectious materials, mucous membranes, or non-intact skin, when performing vascular access procedures, or when handling or touching contaminated surfaces or items. Sterile gloves are used for procedures involving contact with normally sterile areas of the body. They provide protection for both the patient and the healthcare worker. Non-sterile gloves, sometimes referred to as examination gloves, are used for patient diagnostic procedures. Hypoallergenic gloves or similar alternatives should be provided by the employer for workers who have latex allergies. Examination and sterile gloves may not be reused. Utility gloves may be reused as long as they are decontaminated and inspected to ensure integrity. Masks are worn if there is a likelihood of splashing of blood or body fluids into the worker's nose or mouth. Depending on the degree of exposure, protection for the face would consist of a surgical mask in conjunction with goggles or eyeglasses with solid side shields, or alternatively, a chin-length face shield. Protective eyewear, such as safety glasses or goggles, are used to protect eyes from misting. You must wear safety glasses if a manufacturer recommends their use in handling their product. Scrubs are worn in a manner similar to street clothing and normally should be covered by appropriate gowns, aprons, or laboratory coats when splashes to skin or clothes are reasonably anticipated. Lab coats perform a similar function. Fluid-resistant lab coats must be available to lab workers if splashing or misting is anticipated for a procedure. Gowns and lab coats that are used as personal protective equipment must be laundered by the employer and not taken home for cleaning by the employee. Head coverings are worn when invasive procedures are performed that might create splashing or misting of body fluids. Head coverings should cover the hair, ears, and parts of the neck or face. Once a procedure is completed, personal protective equipment must be carefully removed to avoid contaminating skin or street clothes. If protective clothing, such as scrubs, are soiled, they should not be worn outside the work area, nor should they be taken home to be laundered by the employee. Used protective equipment must be placed in designated containers for storage, decontamination, or disposal. Employees must wash their hands after removing PPE. If soap and water are not immediately available, alternative hand washing measures, such as moist towelettes, may be used. Employees using alternative hand washing methods must still wash with soap and water as soon as possible. If employees are in an area where they may be exposed to blood or other potentially infectious materials, they must refrain from eating, drinking, smoking, or applying cosmetics or lip balm, and handling contact lenses. Regulated waste includes used needles and contaminated sharps, liquid and semi-liquid blood, as well as dried blood and other potentially infectious materials. It also includes items caked with these materials and items that would release blood or other potentially infectious materials if compressed. Proper handling of regulated waste is essential to prevent unnecessary exposure to blood and other potentially infectious materials. Regulated waste must be handled with great care and disposed of in accordance with applicable state and local laws. You should wear gloves and use a mechanical means, such as tongs or forceps, to pick up and discard used needles. The needles must be disposed of in a sharps container that is clearly marked with a biohazard seal. Employees are not allowed to open, empty, or clean sharps containers. Good housekeeping and waste management practices will go a long way in preventing exposure incidents. Contaminated environmental surfaces can transmit hepatitis B. Although the chances are small, HIV can also be transmitted from a contaminated surface. That's why it's important to decontaminate surfaces that come into contact with blood or other potentially infectious materials. A written cleaning schedule is required for cleaning areas where exposure to bloodborne pathogens may occur. The cleaning method chosen is determined by the type of surface to be cleaned, the substance that is present, and the tasks or procedures that occur in that area. For example, different decontamination measures would be used for a surgical operating room and a patient room. Also, cleaning up a hard surface floor would involve a different procedure than cleaning up carpeting. A more extensive cleanup would be necessary for gross contamination than for minor spattering. Cleaning contaminated work surfaces with the right disinfectant will ensure that employees are not unknowingly exposed to blood or other potentially infectious materials that remain on the surface. Follow the manufacturer's label instructions regarding the amount of disinfectant used and the length of time it must remain wet on the surface. Bleach solutions are considered appropriate for disinfection of environmental surfaces and for decontamination of sites following the initial wiping up of spills of blood or other potentially infectious materials. Contact time for bleach is generally considered to be the time it takes for the product to air dry. Because bleach solutions lose a large portion of their potency within 24 hours, the solution should be replaced daily. Bleach solutions should not be stored in glass containers. If surfaces or equipment are draped with protective coverings, such as plastic wrap or aluminum foil, these coverings should be removed or replaced if they become obviously contaminated. Reusable receptacles such as cans, bins, and pails must be inspected and decontaminated on a regularly scheduled basis. Regular decontamination will prevent the container from leaking, spilling, or contaminating the outside of the next bag liner. These containers should be cleaned immediately or as soon as feasible after visible contamination. If glassware containing blood or potentially contaminated fluids breaks, do not pick up the sharp pieces by hand, even if you are wearing utility gloves. Instead, use a mechanical means, such as tongs, forceps, or a brush and a dustpan. After the glass has been removed, decontaminate the site with a registered hospital-level disinfectant or a 1 to 10 bleach solution. A spray wipe spray technique is recommended. Before any equipment is serviced or shipped for repair or cleaning, it must be decontaminated to the extent possible. The equipment must be labeled, indicating which parts are still contaminated, so that employees and those who service the equipment can take appropriate precautions to prevent exposure. Before attempting to disinfect or sterilize reusable equipment, blood and other organic debris must be removed. Laundry workers must wear gloves and other personal protective equipment as needed, and handle contaminated laundry as little as possible. Contaminated laundry should be bagged or placed in containers at the location where it is used, but not sorted or rinsed there. Laundry should be sorted or rinsed in the laundry area only. Laundry must be transported within the facility or to outside laundries in labeled bags. If laundry is wet and might soak through laundry bags, then workers must use bags that prevent leakage for transport. In response to concern over sharps exposures, Congress passed the Needle Stick Safety Act, which directed OSHA to revise the bloodborne pathogen standard to require employers to identify and make use of safer medical devices. Employers must also involve workers in the selection process of safer medical devices. An exposure incident involves contact with blood or other potentially infectious materials. It can be through a needle stick or a cut with a sharp object. It can also be through contact with the eye, mouth, or other mucous membrane, or non-intact skin. After an incident, immediately wash the injury site with soap and water. If you experience splashes of blood or other infectious materials to the nose, mouth, or skin, you should flush the site with water. Eyes should be irrigated with clean water.
Rhonda, I just stuck myself when I was cleaning up.
Exposure incidents must be reported to the employer promptly to ensure immediate medical follow-up care.
Okay. And they're gonna do
Exposure incidents can lead to serious diseases such as hepatitis and AIDS. Immediate intervention can prevent the development of hepatitis B, and it can enable the affected worker to track the potential HIV infection. Prompt reporting can also help the worker avoid spreading the infection to others. Immediate intervention enables the employer to evaluate the circumstances surrounding the exposure incident to try to find ways to prevent such a situation from occurring again. Prompt reporting is also important because part of the follow-up includes testing the blood of the source individual, if permission can be obtained, to determine whether that person has been infected with hepatitis B, hepatitis C, or HIV. The employee is entitled to free medical evaluation and treatment if there has been an exposure incident. Exposed employees should be referred to a licensed healthcare provider who will counsel them about what happened and, if necessary, provide any further treatment or testing.
Okay.
While all blood test results and diagnosis must remain confidential, the exposed employee must be informed of the test results of the source patient, if applicable. All other patient and employee confidentiality laws must be followed. Each potentially exposed worker who may be exposed to pathogens as part of their normal job function must read their facility's bloodborne pathogens policy.
Anybody have any questions to start off?
If you have questions about the material covered in this video, be sure to ask your training officer.